Buenos dias todos. Good day everyone, and thank you so much for inviting me to address this virtual public health conference at the Andalusian School of Public Health. It's a particular pleasure to be speaking to so many colleagues in Andalusia. The Andalusian School has made an enormous contribution to training and to research in this region of Spain, but also more generally in Spain as a whole and beyond. And I would like to congratulate the team here for the excellent work that they have been doing over a number of years. So I'm going to be talking about the financial crisis in Europe and its impact on health. I want to begin by saying one thing, and that is that there should be absolutely no confusion whatsoever. The austerity policies that are being pursued by European governments and by the Troika, the European Commission, the International Monetary Fund and the European Central Bank are not fixing the economy. Quite simply, they are not working. In the countries where they're being implemented, the economic situation is getting worse. In contrast, those countries that have avoided austerity, like Iceland, have seen their economies recover. They are now on a sustained period of growth. They have suffered none of the health effects that we've seen in other parts of Europe. But the main point is that these policies are not fixing the economy. And in fact, we are now seeing many of those who at one stage were the strongest advocates of austerity changing their view. The International Monetary Fund has recalculated its fiscal multiplier, a calculation of how much growth austerity takes out of the economy, and has shown that the effects have been much more severe than they first thought. And they, along with a number of prominent economists, have called for a degree of caution and perhaps to slow down the policies that are being pursued. Now you will see on the slide that is being shown the situation in the United Kingdom, to take one example of austerity policies. You can see that, like the rest of Europe and the United States, we suffered a severe blow during the recession, but the economy was growing thereafter. We were coming out of recession until the current government imposed its first budget. It imposed austerity policies, and after that, the economy has flattened. We haven't seen any growth as a consequence. So you ask, why are politicians pursuing these policies? It's certainly not to help the economy. To understand why, we can look at a book that was published about 5 or 6 years ago by the Canadian author Naomi Klein. And this is a book called The Shock Doctrine, about what she termed disaster capitalism. And she described how a number of neoliberal economists would look for crises to take advantage of. She used the example of the tsunami in Sri Lanka, when the developers moved in to the beaches that had been devastated by the flooding. The villages had been swept away. The people who had lived there no longer had their documents to prove that they owned the land. So the developers came in to build new hotels. She looked at how, again, some governments and private corporations had taken advantage of the economic crises in Latin America in the 1980s, and how others, particularly those who favoured private schools in the United States, had taken advantage of Hurricane Katrina in New Orleans. So she was arguing that the responses that we see to a crisis are not necessarily to improve things, but to allow powerful vested interests to take advantage of them. And what I believe in Europe at present is that a number of people are rubbing their hands with glee at the financial crisis that we see. Now, what does this mean for health? One of the difficulties that we have when we try to understand the health impact of the current financial crisis is the availability of data. If any of you take out your iPads or your mobile phones, you can get instantaneous data on the economy. You can find out the value of the stock market to the second. You can find out levels of unemployment within the last month or two. You can find out economic growth, debt and deficit. Again, very much up-to-date data. But if you look for health data, in many countries it will be 2 or 3 years old. In some countries, it's even older. So it's very difficult to know what is happening in the current crisis. As a consequence, we have to look at the experience from the past. We've done this. We have undertaken studies going back to the Great Depression of the 1920s and the 1930s. We've looked at the collapse of the Soviet Union. We have looked at the economic crisis that you experienced in Spain in the late 1980s and that was experienced in the Nordic countries, Sweden and Finland, in the early 1990s. And in all of these situations, we see a very similar pattern. What we see is an increase in death rates from suicide and a decrease in deaths from road traffic injuries. In fact, we even saw this in the 1920s when there were many fewer cars on the roads than there are now. In some countries, these balance each other out, but in some other countries, the suicides dominate. So, what do we see when we look at the current situation? Well, here, when we look at the data from across Europe, we can see that deaths from suicide have been declining for the last few decades. But that came to a stop in 2007, 2008. In almost all of the countries that we have looked at, suicide rates have reversed, they've increased. And the exception to that is one of the countries that has avoided adopting austerity policies, that's Austria, but we see this happening everywhere else. We see it in the new member states of the European Union and we see it in the old member states. We also see, exactly as we predicted, a fall in deaths on the roads, although not everywhere to the same degree. One of the changes in the current crisis from the past is that some countries have managed to reduce their deaths on the roads to a very low level anyway. In the United Kingdom, for example, deaths on the roads are now very rare. The same is true in the Netherlands. So the only countries where we're seeing the decrease in deaths on the road are those where the rates have yet to fall. The Baltic states, for example, Hungary, the countries of Central and Eastern Europe. So in the Western European countries, because deaths on the road are now relatively infrequent, the health picture is dominated by the increase in suicides. Now, that is not the situation to the same extent everywhere. There are some countries that have managed to avoid a rise in suicides, even though they may have had an increase in unemployment. I've already mentioned Iceland as an example. Iceland weathered the economic storm very well. The only effect that they could see of the crisis was a very short-lived increase in attendances at emergency rooms. And when we look historically, we see that although in Spain in the 1980s, the rise in unemployment went hand in hand with a rise in suicides, and when it fell, so did suicides fall. In Sweden, the two were quite disconnected. Unemployment went up and came down, but throughout this period, the death rate from suicide continued to decline steadily. What was the difference? We looked at this in detail in a paper published in The Lancet. And what we found was that the degree of social protection that was put in place in a country was extremely important. Countries with a well-developed welfare state with social protection systems were able to avoid the rises in suicides seen elsewhere. Of all of the social protection policies, what was most important were the active labour market policies. These were policies that tried to keep people in work, and if they did lose their job, offered them retraining, offered them information, and essentially gave them hope that they would be able to get back into employment. So this was a way in which governments were saying to their people that we care about you, we are willing to give you hope. We recognise that there is a difficult economic situation, but we have your interests at heart. We will try to do something about it. We have also seen some other health effects. One of the more unpredictable ones is the impact on infectious diseases. This is always a challenging thing to predict because it involves a complex interaction, sometimes between vectors like mosquitoes, the environment and the individual. We know, for example, in previous crises, such as in the United States, we've had a rise in the breeding of mosquitoes in abandoned swimming pools, leading to an upsurge in West Nile virus in California. What are we seeing in Europe? Well, again, we're seeing a breakdown of public health systems, and we're seeing the emergence of a number of communicable diseases. Malaria has come back to Greece. West Nile virus is now well established in Greece. We have dengue fever in the Portuguese island of Madeira. A number of worrying signs. Well, what I want to do now is to look in a little bit more detail at some of the individual countries. You'll all know that the country that so far has been worst affected has been Greece. We wrote a paper in The Lancet in which we described the unfolding of a Greek tragedy. We described how people were having great difficulty in accessing essential care. The clinics that they normally would go to were closed. They had to travel further distances, and even when they got to those other clinics, the hours they were open were reduced. We have accounts of children who require long-term medication, unable to get their drugs. The Greek government cut the price it was willing to pay for drugs, and the international pharmaceutical companies refused to supply them. But one of the most worrying things that we've seen has been an upsurge in cases of HIV. There's been a major outbreak of HIV among injecting drug users in Greece. So we're seeing really catastrophic effects of the collapse of the health system in Greece. Interestingly, when we wrote our letter, a colleague in the Greek government challenged what we'd said we were exaggerating. It's not as bad as that. So after our paper was published, a journalist from the New York Times, Suzanne Daly, went to Greece to see what was really happening and found that it was even worse than we had said it was. And this is one of the problems. Our governments are often reluctant to admit just how bad things are. Now, you, of course, will be much more familiar with the situation here in Spain. Some of that in some of those we're working with colleagues like Carlos Atunda here in Granada to try to identify what's been happening. We recently published a paper with colleagues from the Balearics that looked at attendances in general practice. And we saw that over the last few years, there has been a remarkably large increase in attendances by people suffering from anxiety and by depression. We're hearing accounts from Catalonia of significant problems in trying to access care. But as I say, you know the situation better than I do, and I'm sure you'll be discussing it after this talk. We also have evidence of a significant increase in suicides, and many of us in the rest of Europe were alarmed to see the suicides associated with people losing their houses, to the extent that we understand now some of the Spanish banks are stopping evicting people because of the risks to their health. In my own country, in England, we have seen a similar picture. In a paper we published in the British Medical Journal, we showed that the increase in suicides was concentrated in those parts of the country where the job losses had been greatest. That demonstrates a clear link between the austerity policies that are being pursued and the health situation. Now, some of you will say the austerity policies are inevitable. What can we do other than cut back on government spending? Well, I've already argued that that is not the answer for the economy. And this is not new. This is something that F.D. Roosevelt knew in the 1930s. And that was how America escaped from the Great Depression. He put in place the New Deal. He built interstate highways, he built dams, he built all sorts of things. He invested in the economy, he invested in people. And the American economy and the world economy recovered. But then we can also look at the situation in the United Kingdom. My government is concerned about its high level of debt, about 80% of gross domestic product. It says that that level of debt is unsustainable. It is making enormous cuts in spending on health, welfare, social care. 80% sounds a lot, but let us look back to 1948 when the National Health Service was put in place. The government at the time was able to invest in the future health of its population at a time when its debt to GDP ratio was not 80%, but was 300%. So if that is the case, it gives the lie to the need for austerity policies. So I hope in this brief presentation, I have encouraged you to challenge some of the economic orthodoxy that you hear. To ask the people who are on the television and the radio who claim to know what is happening and what should be done, whether they really do know. Look back at what they said 3, 4, 5 years ago. How many of them were correct? Very few. You, as public health professionals, have every bit as much claim as they have to analyse the situation and make recommendations. The difference is that you will do so not through a narrow economic lens, but through a lens of population health. You have a key role to play as the voice of the dispossessed, of the voice of the ordinary people who will not otherwise be heard. Thank you very much indeed.